Good morning, ladies and gentlemen. We are opening the second day of the 4th Ukrainian Women's Congress. This year, the motto of the Congress is From Potential to Real Change. Now, the time for real change has come. We'll have a lot of esteemed guests and panelists discussing changing on our numerous panels. But firstly, I have the pleasure of giving the welcoming address for the second day to the First Lady of Ukraine, Olena Zelenska. Good day. Good day, esteemed participants of the 4th Ukrainian Women's Congress. Welcome, everyone. From our last meeting, a year has elapsed, a year that has underscored the importance of the dialogue we started on building a Ukraine of real opportunities. Unfortunately, the COVID pandemic has brought its change, and I can see all of you together in one room as we met last year. But I'm certain that there are more of us this year, more of us brought together by the common ardent desire to live in a country with no distribution of the world belonging to men and women. In September this year, Ukraine made an important step towards equal opportunities. We have made efforts to accede the international partnership via RITS founded by the G7 countries. And I like to say that this has been made possible with the cohesive work of the entire Ukraine, the government, the parliament, the civil society organization, international organizations, activists, diplomats, and I would like to thank every one of them who joined and contributed to the victory. Ukraine has defined a number of important vectors that we will focus on in the future. We need to promote barrier-free public space, prevent and combat domestic and gender-based violence, meet the pay gap between men and women, and create more opportunities for men to care for their children. Now, during the COVID pandemic, the job has become even more necessary and urgent because the pandemic has put new challenges before the humanity and changed their lives, but also made the problems in the society ever more pressing, such as domestic abuse. We had to quickly adjust and adapt to the situation. But the difficult times only strengthen the role of women in the society and in the family. It is us, the women, who during the lockdown, in addition to doing our job, kept the house running. We also helped our kids to catch up with their studies, studying from home, at the background of worries and concern for the health of the dear ones, in the context of uncertainties and stress. So who are the superheroes? In our professional lives, women have to deal with the challenges brought about by the pandemic, particularly the doctors and medics. And as you know, there are more than 80% of medical personnel in Ukraine. We have to remember the education specialists who had to learn quickly to be in a position to teach our children. There isn't a single profession that would not have been affected by the pandemic. So this is especially why the goals we declared before the pandemic remains important and is becoming ever more urgent. A lot has changed in this year, but our priorities remain unchanged. So let's continue building together a Ukraine of equal opportunities. Let us begin. Ms. Olena, thank you very much for your speech. We heard the First Lady of Ukraine, Olena Zelenska, who opened the second day of the 4th Ukrainian Women's Congress. We'll take a very brief pause, and then we will hear a person who is an opinion leader for all. We will hear from Olga Holubovska, an infectionist specialist, and we'll talk about coronavirus and health and women with her. Good morning, ladies and gentlemen. We'll start the first discussion panel for the 4th Ukrainian Women's Congress, Day 2. The guest I'm about to introduce to you is one that I have greatest pleasure presenting. I know you'll be listening to her very keenly. She's an esteemed doctor of Ukraine, a well-known infectionist who chairs the Infectious Diseases Department of Bohomolets Medical University, Ms. Olha Holubovska. Yesterday, I Googled Olha Holubovska, and I can tell you that you're a real star. But I'm very happy to say so, that infectionist doctors and medics have become real stars. We want people to listen and read you rather than someone else. If coronavirus is to thank for anything, we have to thank it for promoting the prestige of the medical profession, promoting the prestige of virus, epidemiology, infection specialists. Those are people who have long combated and prevented and protected. And people used to say we don't need those, but now we realize that we do. So do we need to thank the pandemic? And has the pandemic checked this distortion? Good morning. Thank you for this warm introduction. You've just used the words that I would have used. A few months ago in an interview, I used to say that it might sound scary and we've paid a very dear price, but the pandemic has been a rescue. It has stopped the destruction of the vertical of the sanitary epidemiological survey in terms of infection protection. We've long stopped admitting infection specialists to the medical university, and we haven't done this year either. And hopefully next year that will be corrected through the public order placed with the medical university. Also, the jobs for these professions have been eliminated. And you're perfectly right in saying that but for the pandemic, we would have next seen the full destruction of the infection in hospital department and the specialists for infectious diseases. And that is a specialty in its own right. As every other specialty, it calls for highly trained specialists who would have a full understanding of the subject matter. It's not just about family medicine or intensive care, but it's for infectious diseases treatment. We are now in the second pandemic. We had the first flu pandemic that we've experienced in our infectious hospitals cannot exist in the current paradigm of funding enacted by the Ministry of Healthcare, that the money follows the patients. It's absolutely impossible because we don't know the outbreaks we'll see tomorrow. We don't know the patients requiring medical care. And if our hospitals hadn't been contracted by the National Health Service, they wouldn't receive the funding and they would have died out alongside with the specialists working there. And thirdly, you're perfectly right as well in saying that when I went to the medical school, there were 30 potential students per place. I worked in the surgery department for 2 years as a technician to be given some preferences for my admission to the medical university, even though I've been a straight-A student and all that. But the competition for admission to the medical school was fierce. And now, this year, for the first time ever in my entire life, this specialty didn't make to the top 10 prestigious medical specialties. And that's wrong, because if the doctor don't have the relevant standing, we won't have the people wanting to join the profession, we won't have the qualified medics, and that will take a toll on the people, on the health. I'm responding emotionally because I know the problem, I know the issue profoundly, and I know how to set it right. And that's why we need to deal with obstacles, and I might be drastic in my statements, but I know that's the way it should happen, and when I'm not hurt, then I can be argumentative and emotional. So what should we brace ourselves for? We have over 15,000 diseases, either for total lockdown or more moderate. It's not 15,000. The statistics for infectious diseases has always been underestimating, and the world data, the global data, is falling behind the real scope of infection. We know the estimates in infectious pathology that we do through mathematical modeling, that we do once the story is over. So in a year or a year and a half, we'll know the real numbers. There are far more people who've gone down with COVID. There are friends and families who are sick with all the symptoms like the loss of smell and taste, with mild or moderate symptoms. Many people don't even go to the trouble of taking the test. If they have the light course of the disease, they stay home and treat themselves, and they fall out of the statistics. So the statistics isn't realistic. What about the death numbers? The mortality is interesting too. Globally, we are seeing the numbers that need in-depth analysis, but still, traditionally, if you look at infectious pathology, morbidity and mortality, if you take flu, so the flu virus is the most studied virus after HIV virus, and the news is often said, as Peter Medvedev, the Nobel laureate, said, I'll rephrase his saying and say that viruses is a protein clothed in bad news. And that's very apt. The viruses are unpredictable. The microbes rule the world. We might think we explore the space and all that, but look at a tiny, unknown coronavirus, and it brought the world to its knees. Not a single country, apart from China, could duly rebut the virus. The China and some post-Soviet countries used to have robust sanitary and epidemiological system, and we've been able to repel a number of pandemics because the countries with arising social tensions always are prone to infections. Infections are the mirror of the societal troubles for the Soviet Union. So they were always swept under the carpet, and they had to state that everything was all right. And we were leaders for diphtheria and other diseases. So those sanitary epidemiological systems were quite robust. So what should we expect? No prospects, no projections have lived up to the expectations, and I'm wary of making any projections. If, God forbid, we see a mutation of any kind that could mean that the virus can be transmitted from animal to human and the other way around, then it's going to be an entirely different picture. I hope that won't happen, because globally you see the destruction of the animals, like the population of chickens were destroyed during the avian flu. 130 million were destroyed in 3 months in Asia and Europe. Just think of that. 130 million of chickens were destroyed because of the danger of the transmission of avian flu. And the mortality from avian flu is 70%. If, God forbid, that should happen, then the zoonotic sources, the agents that are passed from an animal to man, are much graver, much more severe. And on the prevention, I am for strict lockdown because the mild measures are not effective. Nothing has changed in the way we prevent and combat infectious diseases. If we don't have specific prevention and treatment, all we can do is breaking the chain of transmission of the disease in the population from human to human. That's the only thing we can do. We need to sever those chains. The way how we do it technically, that's another matter, but those mild actions will not be effective. China has hoped, because they took the measures that we couldn't do, and many civilized countries couldn't do what China had done. So when a new infectious disease breaks out, you need to identify the zero patients, the first original source of infection, and then draw the circle of infection, and it has to be studied and isolated and locked down. And that's a field of work for the epidemiologists. And we didn't have the resources to do that. And that's the only case where you can contain the spread of the infection. Now that we are in an intensive phase of the infection spreading, we are in an intensive phase. We haven't reached the peak yet. I think it's going to happen in January, February. The statistic will catch up in a month. We see growing mortality amongst young people up to 60 years of age, and that's truly scary. So I'm for total lockdown. And when that happens, there's nothing we can do about the regional sources, and we have to see ourselves as once potentially infected. So we have to keep the social distance, we have to wear protective clothing, wash the hands. Now we're into the season. If a person is infected, we are having more severe causes of the disease because due to the weather condition, people get a higher dosage of the agent, and any infectious disease is about the dose. It's dose driven, and we won't get out of that. And I believe that epidemiologists have to have their last say. We shouldn't count the number of new infections because that depends on the quality of testing. And if you test many people who don't have any manifest symptoms, it won't mean that it's a tragedy. It's a tragedy when we see a growing number of severe cases, and there are more than the system can cope with and deliver relevant medical care. So these are not the numbers that you should use for decision-making. That's my opinion. Olga Anatolyevna, Ms. Ola, the Ukrainians, apart from those who are pandemic skeptics, we even have those, but those who are adequate and responsible and know how serious it is, they now went to the pharmacies and bought everything they could. They bought the vitamins and whatnot. Some doctors recommend taking vitamins. Others saying, don't go crazy, don't shovel the vitamins in. So do the vitamins work? Are they effective? Do we need to be consuming vitamins, vitamin C, vitamin D, and all the others? Can we protect ourselves by taking vitamins? Thank you for the question. Traditionally, it's what we've done, not just in this predicament, and it's an extraordinary predicament. And the doctors and our teachers haven't really experienced anything similar, apart from the Spanish flu, which happened a century earlier. Let me give you an example. Traditionally, we have skepticism in governmental institutions. I'm no exception. if we talk about different governmental institutions, they've tried long and hard. So people are used to helping themselves, that's the way we're used to living, helping ourselves. That's why they try to find information from different sources, the past information, and that's a flow of information. I tell my medical students and others that when the pandemic of flu started in 2009 and 10, and I was placed as the chairwoman for the department, I attended the Congress at the time in the United States of America, and we talked about the highest, not just morbidity, but mortality rate. There were no even facial masks available because at that time everyone bought out the mask in the pharmacies. They were not available. People bought out the antibiotics, anything they could buy for cash in the pharmacies. So there's nothing strange there. We can't just simply follow the recommendations that we give to the doctors.
So this is the U.S. protocol that become very popular in Ukraine, starting from prevention and all the way to the treatment. But if the person is not lacking the vitamin D, then he shouldn't use it. Besides, if you use extra vitamins, this would have a negative impact on the human body. And the same for the zinc, because you need to be very clever in terms of admitting these or that drugs or vitamins. You can't be using them for half a year or something like that, because zinc is really a well-proven vitamin for flu, for other respiratory diseases, and they're using that in the United States for softening the symptoms, and it could be used for prevention. But this is not the ultimate medical solution for any type of the flu. Well, whenever we do have a sickness or severe forms of sickness, then there is a publications and a lot of publications mentioning that more vitamin D or more zinc should be used because there is a deficit of vitamins or things like that. But there has to be an individual approach to prescribing this or that medicine. The doctor has to prescribe that. Whenever we don't have an evidence of this or that medical mechanism for treatment, it doesn't mean that we don't have an effective ways of treatment. We are trying to examine a lot of medical devices and medicines, even the old ones, and everyone has to understand that we are trying to come up with something non-traditional, because currently we're trying to minimize the possibility of severe sickness. We need to prevent the critical condition of a sick person or an ill person, because we don't have the resources, and the whole world has no resources. And the doctors are saying, like, stay at home until you're not in trouble. So how do you identify the proper moment when you have to go to the doctor and not sit at home? What is this right moment? Well, in this case, give recommendation, things like that, and everything's going to be fine. This is not the case for these sort of sickness and flu. Well, we need to monitor the risk groups. There are family doctors, and they know that there are risk groups. Well, nobody is monitoring, really. What can I say? Of course, me and my colleagues, we're trying to give lectures, we're trying to tell people what the risk groups are, we're trying to focus on some symptoms, because this sickness is really a very serious one, and one of its characteristics characteristics is that the people feel themselves fairly well until there is some severe symptoms and things like that. So it's a very peculiar thickness. There are methods we could decelerate the course of disease. There are certain methods, and we are trying to apply those methods, but the time factor is of an essence, and this is the most difficult. This is what we are trying to teach to all those patients. And we have a protocol which is quite better, I would say, than the protocol that exists in the European countries. And we've already managed to prevent a lot of patients from getting into the intensive treatment or intensive care units. It's important for us to prevent the severe conditions under the sickness. We have a lot of vaccines, and a lot of companies are already past the third stage of the tests. But unfortunately, we don't have any specific treatment methods. We have them in case of the flu, and in case of these sickness, we don't have any specific methods of treatment. And until we will have them, until we will have prevention methods, this will remain a significant problem. Let's change the topic a bit. We are currently discussing at the Ukrainian Women's Congress, and I believe that the whole medical system of Ukraine is all about the women, because a lot of women are working at the health systems. Have you felt any gender disbalance or any disproportions in terms of the gender in the medical system? Were there any moments when somebody would choose in between a male doctor or a female doctor? Well, yes, in some cases we do have this gender inequality, because we have male managers and female managers, and in some cases they might prefer to have male doctors, and there could be different reasons behind that, because they're afraid of maternity leave, and this would prevent or this would result in more work. Well, I'm not saying that this is a highly peculiar feature, but in some cases it is a possibility. Do you think this going to change in future? Do we need to change this? Well, it's not important whether it's going to be important for the work, really. It's all about the work. What is the work, really? The person has to be an expert, has to be a strategist, because he needs to define the directions for the further development in his or her industry. He has to be straightforward. He has to have certain communication skills, because without communication skills, you won't be able to come up with proper negotiation results or outcomes, because it all depends on the communication, personal skills, and this is where women are becoming kind of in a more advantageous position, because they're winning in most of the cases. So it's important for the person to have those skills, and whether it's men or women, that's an absolutely different question. It all depends, really. And I had many situations in my life. It all depends on the wisdom of the person. The person has to be clever, has to be wise. If he is a manager, really, then he will think, then he will do the proper assessment. And whenever he's trying to use, he or her is trying to use emotions, well, that's not going to be really the most effective case. Let's go back to the major topic. I'm really interested about those patients without any symptoms. Some news saying that they're the most contagious, others not. Well, of course, they are contagious. Besides, those patients are really the locomotive for the pandemics, because out of the whole population of the people, well, the children in most cases would have no symptoms, and they really drive most of the pandemics, because they go home really without showing any symptoms, and this creates a risk for those people that are in the group of risks. What I like about the United States is that they're trying to test everything. But it's impossible really to test everything, especially in Ukraine. And some people trying to compare how many testing were made in France or England or London. But it makes me funny, really. At once you were happy when we were eliminating a lot of entomological centers, and really last year we had 4 laboratory centers for epidemics, so only 4 for the whole country. And when I was asking, like, how are you going to transport the materials, and we had no pandemics at that moment, while I knew we would have a pandemic because of contagious material, things like that. And why was that? Because the experts of the World Health Organization told about this in 2018. I was, for a certain period of time, an advisor to the Minister of Health, so I've established a working group, and we've stopped the further elimination of the laboratories, those 4 laboratories that I've mentioned. Hopefully we managed to save them. Now the experts in the United States, they came up with a very interesting approach. They've changed recommendations to the testing in their documents, and we've did the same. If a young person is demonstrating any symptoms, and it's hard to say whether he is sick or not, and if we have any respiratory symptoms, everything should be considered as the coronavirus unless proven otherwise. And he can be tested or he cannot be tested, but it's better to test. But the groups, the risk groups, the people in those risk groups, they should be tested definitely, because this person, he will recover very fast. But those people in the groups of risk, they have to be tested. Now, what advice could you give to the parents of those kids that are attending school? Okay, the kid came home from school. What's your advice? Well, nothing really. If the kid is healthy, then no problem. Whenever there is a sickness, whenever there is any respiratory problems, then those people from the groups of risk, then they have to do the testing, like after 4 or 5 days from the contact. Well, you know the situation in the regions. It's really a difficult situation, and the most severe problem we have is that people go to those testing centers, they stand in line, they wait, and they become, kind of sick and contagious. What I want to say, that people should stay calm. First of all, we already have the treatment methods developed, and the people from the risk groups, whenever they have symptoms, they should do the tests, but something up to 30%, they may have negative positive results to the PCR tests. And why do we have those false results? Well, because they could be different contagious agents. What was the test? How was it made? What was the procedure? There has to be some specific stakes or some cotton stakes that has to be used for taking the test, and that could result in false results. So the test. So we have to identify the group risks, and they should be admitted to hospital in accordance to our regulatory documents, because we have proper consideration of that. Well, once again, people over 60, people with diabetes, people with excessive weight, those are the people with in a group risk. And then people with excessive weight, they have significant risks. People with heart diseases, with lung diseases, and pregnant women. Now, they are all part of the risk groups. And testing is really important, not for the diagnosis. And by the way, the WHO has introduced certain changes into their approach. And for me as a doctor, it's not important to have PCR test results, because there are other issues that I could use, like we have only 30 seconds. Now, you can address Ukrainians, all of them. Could you tell us something important? Well, everything has its end, and even after the most difficult period, there will be a time of recovery and peace. And I'm an optimist, really. And I do believe that we have a lot of wonderful people, a lot of patriots who really take care of their country and our people. And I think we had to pass this test in order to re-evaluate some of our values. So everything will be great. Stay safe. Well, thank you very much for this discussion. It was really an interesting discussion for me. And once again, I'd like to remind that we had here an infectionist specialist and the head of department at the National Medical University, Olga Golubovska. Thank you very much.